High cholesterol, you literally can't feel it, but it's constantly working in the background, quietly threatening your cardiovascular system. Welcome to today's Explainer on the Medicine Diary, where we're going to break down how modern medicine tackles this invisible danger. Specifically, we're taking a really close look at a powerful dual-action medication known in the US as a Roszet. We're going to explore exactly what Rosuvastatin calcium and Ezetimibe tablets actually are, when they're indicated, how the dosing works, the side effects you absolutely need to watch out for, and the global economics behind the treatment. If you or someone you love is managing dyslipidemia right now, you are definitely going to want to hear this.
So let's start with a super common and frankly pretty frustrating scenario. You go to your doctor, they run some labs, and tell you that your LDL, your bad cholesterol, is just way too high. To hit it hard, they prescribe two completely different cholesterol-lowering mechanisms. Naturally, the very first question that pops into your head is, wait, do I have to space these out? Nobody wants to take one pill with breakfast and then set an alarm to take another one right before bed. Juggling multiple medications throughout the day can just be a total nightmare for a normal routine.
Well, good news. The answer is no. Based on FDA labeling and clinical data, Ezetimibe and Rosuvastatin can be taken concurrently. You absolutely do not need to space them out. Actually, they are routinely formulated together as a single combination pill that you just take once a day. This is a massive win for making life easier. By taking them at the exact same time, it completely removes the headache of managing multiple pill bottles all day long.
Section 1. What is this medication? The combined powerhouse pill.
Okay, so how does this actually work? Well, rosuvastatin is a statin, and its main job is to target your liver, basically shutting down your body's internal cholesterol factory. But your body also pulls in cholesterol from the food you eat. That is where the ezetimibe comes in. It works down in the digestive tract to physically block the absorption of cholesterol from your diet. So think of it like this. When you combine them into one medication like Roszet, you're simultaneously shutting down the internal factory while locking the front door so it can't get in from your gut. It's an incredibly brilliant dual-action defense against LDL.
Section 2. Proper dosage and timing. Finding your daily routine.
Let's look at the dosing. There are 4 available dosage strengths for Roszet. Do you notice a pattern here? The ezetimibe dose, the part blocking absorption in your gut, stays perfectly static at 10 milligrams no matter what. The variable part is the rosuvastatin. Depending on your specific cardiovascular risk and your target LDL levels, your doctor is going to individualize the statin dose to be either 5, 10, 20, or a maximum of 40 milligrams. It's just taken orally, once a day, and the guidelines actually suggest that doctors can check your blood work to see how well it's working as early as 2 weeks after you start taking it.
Section 3. Guidelines and cost effectiveness. The global standards.
Now, when it comes to the 2019 Joint Guidelines for Managing Dyslipidemias from the European Society of Cardiology and the European Atherosclerosis Society, the whole medical world pays attention. I mean, they analyzed mountains of clinical data to figure out exactly how aggressive we need to be with lipid modification to actually prevent catastrophic events like heart attacks and strokes.
50%. That number is just massive for patients categorized as very high risk. So folks who already have cardiovascular disease or maybe very high risk type 2 diabetes, the guidelines strictly recommend that their LDL cholesterol has to be slashed by 50% or more from their baseline. And honestly, hitting a 50% drop with just a basic statin by itself is incredibly difficult. That's exactly why combination therapies like rosuvastatin and ezetimibe are pushed so heavily. If you aren't hitting the goal, this combo is the scientifically backed next step.
We also have to look at the economics here, because that matters. A systematic review of this drug combination analyzed its efficacy, safety, and its overall cost. And the data proved that this combo is a highly cost-effective choice. Now, obviously, exact retail prices for the brand name Roszet in the US are going to bounce around based on your insurance, your pharmacy, and where you live, but the broader economic research evaluated it against a willingness to pay threshold of 59,600 Chinese yuan per quality-adjusted life year. Bottom line, the review concluded that preventing the massive long-term costs of cardiovascular disease makes this dual pill a highly effective, economically sound standard of care around the globe.
Section 4. Side effects and warnings. What to watch for.
All right, let's talk side effects, starting with the common ones. These include things like headaches, some dizziness, maybe a little stomach pain or nausea, general muscle or joint achiness, and even cold symptoms, like a stuffy nose or a sore throat. For most people, if these pop up, they're pretty manageable, but they are a sign that your body is adjusting to the medication, so you should always keep your primary care doctor in the loop if they're persistent or just really bothering you.
Now, we need to shift gears because this part is absolutely crucial. These are the severe warning signs. If you experience any unexplained muscle pain, tenderness, or weakness, and especially if it comes with a fever, you have to contact a doctor immediately. The exact same goes for dark-colored urine, jaundice, which is a yellowing of your skin or the whites of your eyes, or just extreme severe exhaustion. These can be red flags for a really dangerous condition where your muscle tissue starts to break down, which can ultimately cause kidney failure. Or they can point to active liver issues. This is precisely why you cannot take this medication if you have active liver disease or cirrhosis.
Another really important layer of safety here is that monitoring needs to be individualized. Based on FDA labeling and Cleveland Clinic data, the risk of that severe muscle breakdown is actually higher for specific demographics. If you are 65 or older, of Asian descent, or if you have pre-existing kidney disease or poorly controlled hypothyroidism, your doctor has to monitor your dosage and your reaction to it super closely. Medications just process differently in different bodies, right? So these specific risk factors require a highly tailored approach.
And finally, before we wrap up the safety section, there is a very strict warning here. Do not use this medication if you are pregnant or breastfeeding. The medical data is absolutely unequivocal on this. It may harm an unborn baby. If you become pregnant while you're on it, you need to stop taking it and tell your doctor right away. It's highly recommended that you discuss reliable birth control methods with your provider to prevent pregnancy while you're on this therapy.
Section 5. The Medicine Diary Outro. Taking control of your health.
We've covered a ton of clinical ground today. From the clever dual-action mechanics of Rosuvastatin and Ezetimibe to that strict 50% reduction guideline, all the way down to the vital safety warnings. But please remember, a pill is just one piece of the puzzle. This medication is designed to go hand in hand with a low-fat diet and healthy lifestyle habits. I really hope breaking down this data has empowered you with a clearer picture of how these meds work and what to look out for. But I'll leave you with this question. If your goal is cutting your risk in half, is your current daily routine actually getting you there? Your health is your absolute most valuable asset, and staying informed is the best way you can protect it. Subscribe to the Medicine Diary for regular health and medicine awareness, and share it with your loved ones.